foot. It's usually found between the third and fourth toes, sometimes the second and third. Patients can sometimes describe the symptoms as it feels like there's a watered up sock, or there's a pebble in their shoe. They might have some numbness, some burning, some tingling type pain. This is often worsened with activity or higher heeled shoes or shoes that put more pressure on the ball of their foot. And as the nerve becomes more swollen and thickened, you can sometimes even see a splaying between the digits, like the third or fourth toes or the second and third, or even feel a clicking sensation in the foot. The neuroma is caused by rubbing and irritation of the nerve underneath the soft tissues of the foot as the foot collapses. So the arch collapses, the forefoot splays, the nerve gets drawn forward, gets rubbed and irritated, and that leads to swelling around that nerve. And again, this can be exacerbated by activity in a foot that hyperpronates, or again, higher heeled or tight-fitting shoes. So treatment of the neuroma involves reducing the symptoms and ultimately controlling the mechanics that are causing the rubbing and irritation of the nerve. So a big mainstay of treatment is going to be supportive shoe gear and orthotics, which are designed to help to support your arch and prevent the forefoot splaying, which causes the rubbing and irritation of the nerve. By controlling and supporting the arch, it takes the irritation off of the nerve, allows the nerve time to heal, allows the nerve to shrink down and the swelling to go down and your symptoms to resolve. Other options are quick fixes are cortisone injections. Those are steroid injections that are injected into the nerve that temporarily reduce swelling and inflammation, but again, these are only a temporary fix, and unless you control the underlying cause, the symptoms can reoccur. You need to be cautious with the steroid injections because they can lead to atrophy of the fat pad on the bottom of the foot, or sometimes they can jam into the joint capsule and lead to some dislocation of the digits. There's padding off of the area, adding a variety of pads to your shoes or to your orthotics, again, to help to offload that area. If these conservative measures fail, some non-surgical ways of treating this is something called sclerotherapy. It's a series of 4% alcohol injections, usually about a series of anywhere from 3 to 7, to desensitize the nerve. Again, controlling the underlying mechanics to prevent recurrent nerve rubbing and irritation. If that fails, really the last resort would be surgery. The nerve, when it is getting caught in your foot, it's getting irritated underneath something called your intermetatarsal ligament. There's surgery called a minimal incision nerve decompression where you just release that intermetatarsal ligament without cutting that nerve out. And if that does not help, the last resort would be actually to remove the nerve. But that leads to permanent numbness in that area where the nerve was removed. And eventually, over time, the nerve does try to grow back, and sometimes it can grow back into what we call a stump neuroma that can be more painful than the original condition. So most of the time, this is very well controlled conservatively with proper shoe gear, modifying activity, the right orthotics, and if necessary, maybe some sclerotherapy injections, and so this rarely ever moves forward to becoming a surgical option. Well, the outcomes would be having you be able to perform your activities without having the numbness or burning in your foot, and really it's long-term controlling the mechanics to prevent the nerve irritation. So if you move away from your supportive shoes, your orthotics, revert back to unsupportive shoe gear, barefoot walking, again the nerve can continue to become re-inflamed and the symptoms can start again.